Lesley,
Yes.
come to the clinic today, Silver Blue Women's Health Clinic. So what treatment have you come along to be a model for us for today?
Microneedling.
Okay. You ever had anything like it done before?
No, I haven't, no.
What do you know about it?
Not a lot really, just a lot of little needles and to stimulate your skin, so I think, and to hopefully renew it a little bit.
Okay. And what main things are you hoping will come out of it? What's made you sort of get in touch to have the treatment?
Well, basically, just to
Try and make my skin feel a little bit fresher and maybe clear some of the wrinkles that are swiftly developing. Now I'm 50 and going through menopause.
Oh.
No.
Well, we can certainly help with that. So as you know, we've talked about before, so the treatment involves very little downtime. So what's going to happen is we're going to prepare the skin, we're going to get a needling device that's got a cartridge in, which there's videos on the website. So the cartridge goes up and down into the skin at different depths. So it's a 3-pass technique. So what we're going to be doing first is working on the forehead and a roundabout circular motion. We apply some serum on there. So when we apply serum to the surface, sometimes it can take a while to get to where we want. But by creating these little micro channels, it helps that to get where it needs to. So provide nutrition. When we've done that area, we work on sort of the main areas, so the cheeks, and then sort of the chin area. And then when we've done that, we use an upward motion for the second pass in those the 4 areas. And then on the third pass, we're doing it in to out. When we've done that, we then work in the, sort of the nose area, sort of the nasolabial folds, around the lips if need be. The nose can be a bit funny, there's a little bit of a vibration sensation rather than a pain sensation.
Yeah.
And we work quite closely, not on the eyeball, but very close to that area, so we can stimulate that.
Yeah.
We also work on the neck, because that tends to give us away a bit with our age as the years go by.
Heads are full, yeah.
Yeah, and it's a little bit sensitive in that area, because the tissue is quite thin, so we're aiming long term to sort of rebuild that. So you're not going to go out looking like an absolute film star today, but that is coming in the future.
Yeah.
In terms of the sort of downtime, there might be a little bit of redness and pinkness for a few hours. And like we said before, you know, not going from extremes to hot and cold is the sensible thing at this time of year.
Yeah.
Definitely no sun exposure. Even at this time of year, we'd recommend SPF 30
Yeah.
because that causes its own damage. Making sure that you've got plenty of vitamin C in the diet, plenty of fluids. So remember sipping fluids regularly rather than gulping them down.
Yeah.
Pay attention to hydration. We have got a sample pack for skincare for you to take home to try as part of the treatment, so you can apply that afterwards, and that will help moisturise and nourish the skin. There may be some little tiny pinpoint bruises around the thinner areas, but they will settle, so you can either use a cold compress or an ice pack on that area if needs be.
Yeah.
But pretty much back to normal activities within a few hours or so.
So how soon can you put makeup on, say, or?
We tend to recommend, once it's calmed down and it's feeling good, if you, there's no point putting it on straight away because that can cause irritation.
Yeah.
But one thing we would say is use clean makeup brushes. If you can use things like mineral based, then that'll help as well.
Yeah.
Most ladies it's sort of within 48 hours, but just make sure that your makeup brushes are clean.
Yeah.
So the easiest way to do that is make sure they're clean before you use them.
Yeah.
When you finish using them, have a little bit of alcohol gel in the hand, rub
Yeah.
it in there, a bit of tissue,
Yeah.
put them back in the pot.
Yeah. Good. Okay.
And that's pretty much it.
Yeah. Okay.
Shall we have a go?
Yeah.
Right then ladies, so obviously we've literally just come out of the room. How are you feeling?
Good.
Feel good. Yeah.
Feel fresh, feel like, yeah, I've had something done for sure.
Well, you're a little bit pink at the minute, and we have literally
Yeah.
in the last 5 minutes finished the treatment. So this red sensation, so you'll see when we look in the mirror, obviously we're under really bright lights as well, but those sort of track marks will settle down.
Yeah.
So what we've done, the first part of wound healing is the inflammatory phase.
Yes.
So that's telling us that, hey, something's gone on, let's kickstart your natural process. So that redness, you may have the odd little mark, particularly because we're concentrated around the eyes,
Yeah.
around the lip area, and there's lots of blood vessels
Yeah.
there. It's also quite thin, and it's also your first treatment. In terms of yours, obviously we can't
Brilliant.
see a great deal because
No.
we knew it was the milder form.
Yeah.
But the chance it's going to feel, I don't know how to describe it. Whenever I use this,
I can feel
particular
it
treatment.
starting to feel a little bit taut, as in,
Yeah.
you know, it's tightening up a little bit. But
A bit.
I mean, but
Not
as
even
far
this
as
one.
as far as having the treatment was concerned, there wasn't any. You know, I didn't really had a little bit of a tingling sensation, but that was it. So it felt nice. It was lovely.
Well, what we were saying, obviously with the product launch and things, we're getting the nurses trained on, is that we'll probably pick up where we've left off and get you both on the programmes.
Yeah.
Both ladies would like to do a blog with us.
Yeah,
So really
definitely.
good,
Yeah.
looked at their journey.
Yeah.
So it's a good job we took before pictures, because by the end you won't recognise
That's the plan.
them. So it's nice and straightforward, and there's
Yeah.
no tears.
No,
No, not at all.
No, brilliant. And the communication all the way throughout was great, so that you constantly check it.
Feeling reassured.
Yeah, constantly.
Is everything okay?
Yeah.
And
Yeah,
you know.
brilliant. Yeah.
You've got the skincare to take home to have a try.
Yeah, I'm
Yeah.
excited about that. That's
Yeah.
going to
Yeah.
be good. I have a feeling that may be costing me quite a bit of money in the future.
Wow. It doesn't.
If I get addicted to this.
Yeah. And
Well,
I'm
the good
looking forward
thing
to
is-
using it.
It's really natural ingredients in there. They're all designed to support collagen growth as well.
Yeah.
I think because it's the marine biology that you've got that goes with it. It's the most natural.
Yeah, but we're
form
buying
of
it from
collagen.
professionals rather than a counter.
Over the counter,
or,
yeah.
Or on an aeroplane where it's spending 50 quid on
Yeah,
something.
I know,
you
it's absolute rubbish.
Yeah.
And to be fair, the products are designed to maintain and support collagen growth
Yeah.
using natural ingredients. So there's no parabens, there's no perfumes,
Yeah.
which we can't have in the UK anyway. But the actual products themselves, you'll find, especially because your skin for the next 24 hours is going to be like an absorbent
Yeah.
sponge.
Yeah.
So that extra moisturiser one as well. Things like the mist, you want to use that a
Yeah.
bit more
Just
to that.
just get it. Yeah. Give it a good boost. Yeah. Brilliant.
Fantastic.
Great.
New women.
Thank you.
Thank you very much for having us.
Yeah. Thanks so much.
Come again.